Good day everyone, I am Aryan Jean Imbarba and now I'm going to perform the proper procedure of cleansing with bath or CBB for the purpose of giving the patients a comfortable, fresh and fragrance and to help them to boost their self-esteem as well as their self-image and to help them about their circulations of blood and to assist their skin conditions, then to avoid them from the spreading of microorganisms and to avoid bed sore. Before proceeding to the right procedure of cleansing with bath or CBB, we must follow the 12 sequence, which is first, always read the patient chart, diagnosis, and know the patient's status, as well as always read the doctor's order. Then, go to the patient's room, greet the patients, introduce yourself, and as well as the patients. Then, check patient's vital signs and ask permission to leave and prepare the materials needed. Then, before leaving, always lock the wheels and side rails to avoid any form of accidents and provide patients privacy. Good day, ma'am. I'm your caregiver for today. Aryan Jean Barba, 7 to 3 p.m. And now I'm going to clean your. I'm going to do the cleansing with bath, which is to give you comfortable, fresh, and fragrance, and to avoid you from the spreading of microorganisms. Then to help you boost your self-esteem as well as your self-image. Then to prevent you from bed sore and are going to assess your skin condition. So, may I know your name, ma'am?
Maria.
Okay, Maria. So, ma'am, may I go out and prepare the materials and tools needed and I will going to come back immediately. Okay, ma'am, thank you. Then, before leaving, always lock the wheels and side rails to avoid any form of accidents. As if I'm done preparing the materials and tools needed and I'm done wearing gloves and PPE as well as I'm done washing my hands. And now let's proceed to the proper procedure of cleansing bed bath. So while entering the room, always provide privacy for the patients and always ask for the patients if he wants to defecate or urinate. So ma'am, do you want to defecate or urinate, ma'am?
No.
Okay, ma'am. So now, ma'am, I'm going to check your vital sign or temperature. Okay, ma'am, your vital signs are good and it's normal. So I'm going to proceed to the cleansing bed bath. Now, change the patient a bath towel and always apply the wrong side to avoid the patients from getting rash. Then always remember to pull it together and preserve the patient's dignity. And take out the sheets of the patient and put it to under the feet. So after changing the patient's bath towel, and now we're going to remove the patient's gown. So first, we must position the patients to a lateral position. So first, we're going to raise the arms, which is the affected arms, carefully. And other arms to the abdomen. Then we're going to bend the knee of the patient. And we're going to position here to a lateral position. Then we're going to untie the ribbon and back to supine. So, carefully take out the gown to the unaffected area to affected area. So, And always preserve a patient's dignity. So, we're going to remove the gown to affected area. Then, we're going to pull out the gown. And we're going to form it into the ball and put it into the hamper. Then, we're going to put a bath towel to the chest of the patients to avoid the linen from getting soiled and wet. As well as put a patient's bath towel under the neck so that the pillowcase will not going to soiled and wet. So now we're going to create a square mitt and clean the eyes of the patient. We're going to clean the farthest eyes of the patient, so the inner to outer canals. So wash, rinse, inner to outer cantos, then wash, rinse, inner to outer cantos, wash, rinse. And we're going to pat dry the eyes of the patients using the bath towel. So, after cleaning the eyes of the patients, now let's clean the face of the patients to the farthest and nearest. So, wash, rinse, and we're going to apply the estros to the farthest forehead, cheek, bridge of the nose, cheek, and under the ear. Then, pay attention to pinna. Then, after cleaning the farthest, let's clean the nearest area. So, wash, rinse, then always remember to apply the estro under the nose, chin, then pay attention to the pinna. After cleaning the face and the eyes of the patients, always remember to clean the neck of the patient. So, wash, rinse. Wash, rinse. Then, after cleaning, we're going to pat dry the face and the neck of the patients, also the eyes, using this bath towel in her chest. And now we're going to clean the chest of the patient, and we're going to expose it if the residential is going to approve to expose it. So the residential is approved. Expose the chest, then sternum, under the breast, side, cross. Sternum, under the breast, side, cross. Then cover it. Then wash, soap, rinse. And again, sternum, under the breast, side, cross. Sternum, under the breast, side, cross. So after cleaning the chest of the patient, we're going to pat dry using the bath towel. And now we're going to clean the abdomen of the patients, and we're going to expose it. Then we're going to make a square meal. But first, always remember to divide the patient's abdomen to four quadrants, which is the right upper quadrant and left upper quadrant, then right lower quadrant to left lower quadrant. So we're going to make a meet. Wash, soap, and release. So we're going to expose it. Divide it to the four quadrant, which is the right upper quadrant and the left upper quadrant, and then right lower quadrant, then left lower quadrant, and the umbilicus or navel. So right upper quadrant to left upper quadrant, then pay attention to umbilicus or navel, then wash, soap, rinse. Right lower quadrant to the left lower quadrant, and pay attention to the umbilicus, then pat dry. So now we're going to clean the arm of the patient, which is the farthest area. So we're going to expose the arm of the patient. And use the bath towel and put it under the arm of the patient. To avoid the mattress from getting soiled. Then after that, cover to avoid the patients from getting chilled. Then create a square mesh. Wash, rinse, soap. Open the bath towel. Then distal to proximal, long firm stroke, and pay attention to the axilla. Then cover. Then wash, rinse, then open distal to proximal, long firm stroke, then pay attention to the axilla, then cover, and wash, rinse. After doing that, do the same procedure to the nearest area. Then after cleaning the arm, the farthest arm, clean the patient's hand by using the soap and hand brush. So put it in over the towel and open the towel, then soak the patient's hand to the basin, then wash. And brush the patient's hand, the fingertip. Then pat dry. Now we're going to get the towel and put the patient's arm to beneath the blanket. Then now let's proceed to the farthest area of the leg, and we're going to expose the leg of the patient. Then put a towel under the patient's legs. Then cover it to avoid chilling. And we're going to make again a square meat. towel, then wash, then soap, open, distal to proximal, long firm stroke, pay attention to the popliteal area and groin. Then cover. Wash, rinse, then distal to proximal, long firm stroke, pay attention to the popliteal and groin. Then pat dry using the bath towel. So after patting dry the legs of the patient, get the towel and put it under the foot of the patient. Then we're going to expose the foot of the patient. And we're going to get the basin with a warm water. Then soak the patient's foot and then apply soap. Then brush the patient's foot and rinse. Then pat dry. After patting dry, get the towel and cover the foot. After cleaning the farthest area of the arms and legs, do the same procedure to the nearest area of the arms and legs. We're going to position the patients to a lateral position in order for us to clean the back of the patient. Place the hand, then hand over the abdomen and bend the knees, then 1, 2, 3, go. Then put a bath towel to the back of the patient to avoid the mattress from getting soiled. So now we're going to clean the back of the patients and we're going to put a soap to the back of the patients. So wash, rinse, then apply soap. Then we're going to open the blanket and clean. So inferior to superior, long firm stroke, then circular stroke, and pay attention to the scapula. Then cover it. Then wash, rinse, then open. Inferior to superior, long firm stroke, then circular stroke, and pay attention to the scapula, then cover it. And now we're going to pat dry using the bath towel in the back of the patient. So open and pat dry. Then cover. So after patting dry the back of the patients, put the towel to the back of the buttocks of the patient. Then we're going to ask a permission to expose the buttocks of the patient to any family, relatives, and companions. So it's exposed. Then we're going to make a net. So in cleaning the buttocks, we're going to apply only a one stroke, which is the circular stroke. So wash and then apply soap, then expose the buttocks. So circular stroke. Then pay attention to the ilias, subtrum, and the coccyx, then ischium and the gluteal fold. So cover it. Then we're going to rinse the patient's buttocks. So expose, then circular stroke. Pay attention to the ilias or the hip bones. Then the sacrum, coccyx, then ischium, and pay attention also to the gluteal fold. And close. Then we're going to pat dry the buttocks of the patient using the towel. So expose, then pat dry. And cover it, then get the towel and dispose it. So after cleaning the buttocks, offer a patient a back massage for her to relax and to help with her blood circulations. So, ma'am, which do you prefer in back massage? A powder, lotion, or oil? Powder. Okay. So, always remember that when you're going to massage, always take out your gloves. Then discard it. Then apply a powder which her preferences. Then do a back massage. So apply the 5 back massage which is the circulation, compression, tapping, kneading, and vibration. So circular, compression, then tapping, and kneading, then vibration, and cover it. Then position the patients to supine position. So after turning the patients into supine position, then make or wear a patient's a new gown. So put it on the top of the patient and then first wear the affected area carefully. Tuck it in, then to the unaffected area. And pull the bath towel of the patient. Pull it down. Then after that, position the patients to a lateral position. So raise the affected arms carefully and one arms to the abdomen, then bend the knees of the patient and do the body mechanics. So 1, 2, 3, tuck. Then tie the ribbon of the patient and back to supine position. And then change the bath towel to the new top sheet of the patient. So drag the bath towel new top sheets. Then dito the patient, and drag the bath towel under. Then after dragging the bath towel, then we're going to make it just like a bowl and put it to the hamper. And now the patient is comfortable, fresh, and relaxed. So that's all. Thank you.